Thank you everyone for inviting me in this speaking and in this conference. I feel very pleased to be here and to meet all of you, even though it's online, but it's okay because it's a good start for us. That is, we have the conference or we have a meeting together. So this meeting is a good start for our relationship, and because we can learn and we can share our experience. So I love this meeting and I just like willing to join and I happy to. And good afternoon everyone again. So I'm Surinyapon Singchan, a lecturer from Baromaraja Chonali College of Nursing Surin. So the topic for today is, I think it's because of the CKD, it's increase in the around the world, and this disease is have the many problem. It can cause a lot of problem, including the physical, mental, and social and economics. And also the group of this patient gonna have the problem in quality of life. So the nurses play a vital role in providing nursing care to promote the quality of life. That's why the topic for today that I would like to emphasize is the role of nurses in caring for patients with chronic kidney disease. So I will say it in abbreviation CKD. Okay, it's work. For the outline for today, for my talk. So everyone see my PowerPoint, right?
Not be appear
Not
in
yet.
our screen.
Oh, not yet, right? Oh, sorry.
Not yet.
Okay, I will figure it out.
Yes, we can see it now.
Right now you can see, right? Okay,
Yes.
great. So for outline, I'm gonna divide my talk into three parts. The first one is introduction in CKD, and the second one and the third one is important for nurses that we should know about this. It's how to slow the progression of CKD and the nursing care in CKD. So for the first one, for the CKD, I would like to talk about the definition of it, because the definition of it is very important, because we have to know that if we saw the diagnosis of patient that this one is got CKD. So why is we have to looking for why it's diagnosed with CKD? The CKD is defined as abnormality of kidney structure or function that is present for more than 3 months with implication of health. And either of the following present for more than 3 months, including the albuminuria. So you will see like they have the albumin excretion ratio more than or equal 30 milligram per 24 hours, and albumin to creatinine ratio more than or equal 30 milligram per gram. And also, some might have a urine sediment abnormality. It is hematuria. And have electrolyte and other abnormality due to tubular disorder. Or they will have abnormality detected by histology, or structural abnormality detected by imaging. This one like if we go to X-ray, so will someone is show that the size of the kidney is smaller than normal. So the other definition is they might have a history of kidney transplantation. And for the definition that we can conclude that this one half of about the CKD problem is we look at the glomerular filtration rate that we can call GFR. It's lower than 60 ml per minute per 1.73 square meter. So that's why that is about the definition of kidney disease. So it's a chronic one. So we have to look at about the time period that or the problem that they have should more than 3 months that I talked before. And then it's about how we know that what is the progression of the kidney disease, how severe of it. So we can classify, the CKD is classified based on cause, GFR category, and albuminuria category. This is from KDIGO. The KDIGO is the kidney disease improving global health outcome. That is, they just have the outline or the guideline for this. So this table is show if we look at the GFR category, we will know that uh, which one is the severe or which one is just like start to be a CKD. So it divide into the category is have 5 category, but for the category 3, it's divided into A and B. So you will see that the G1 is the category 1. We look at GFR, it's more than and equal 90. So we can consider that it's a normal or high for GFR. For the G2, the GFR is 60 to 89. This one is the term is mildly decrease of GFR. So the G1 and G2, it's not too severe to start to have a CKD. But start from G3A, the GFR is 45 to 59. This one, the term we call that, this one is in the stage of mildly to moderately decrease of GFR. And for the G3B, the GFR, 30 to 44. This one is getting worse, like in moderately to severely decrease. And the G4, the GFR is 15 to 29. It's severely decreased of the kidney function. And the last one that is that we know that it's called end-stage renal disease. This one, the GFR is less than 15. So this one, it's like a kidney failure. So in the last stage, we have to get like a RRT or renal replacement therapy, such as hemodialysis or peritoneal dialysis in the last stage. So if we look at this category, so we will know that how severe of that person that is what the progression of them or what is we have to uh, give them the nursing care or the advice or education. So we have to look at about this one first. And also the KDIGO have the albuminuria category in CKD also. But in Thailand, we don't have, we use only like estimate GFR to look at like what category that person in. But we don't use like albuminuria in the local hospital. But in the big hospital, they use both to look at the progression of the kidney disease, like to make a better prediction that is gonna getting better or getting worse. For the if we use albuminuria category, it's divided into 3 categories. We have A1, A2, and A3. So this one we use like the albumin excretion rate and albumin to creatinine ratio. So it's a kind of like we have divided into 3 term of it. For the A1, if AER is less than 30 or ACR is less than 3. It's a normal to mildly increase. And for the A2, it's a half 30 to 300 for AER. And for ACR, it's half 3 to 30 as a moderately increase. And for the last one, it's more than 300 for AER. And for the ACR, it's more than 30 and more than 300. It's severely increased. So this one, if we use the albuminuria category to look at like how severe of the CKD. And I would like to share about the in Thailand the incidence of the CKD. The top three causes of the CKD are diabetes, hypertension, and glomerulonephritis. This one is the top three causes that make people have the CKD. And diabetes and hypertension cause approximately 70% of CKD cases. So when we take care of person with diabetes or hypertension, so we need to look at like how is their kidney function also, because both of the disease can cause the person has a CKD. And the CKD is a major public health problem around the world. This one, the statistic is around the world. In 2015, the prevalence of CKD was 11 to 13% or 2 million people around the world. So it has a mass of number, right? And in Thailand, for this one is the information from Thailand. 17.5% of Thai suffer from CKD stage 1 to 4, that accounting for more than 8 million people. That one we found all is 8 million people. And stage 3 to 7.5%, followed by stage 2 and stage 1 is 5.6% and 3.3% respectively. This one is information from Thailand. And for the end stage CKD that I talked before, that is the person have GFR less than 15 cc. On this group, they have to get hemodialysis or peritoneal dialysis. These are information in Thailand said that we have more than 70,000 people that have to require for the hemodialysis and PD, peritoneal dialysis. And for Thai government, it's take a responsible for the treatment fee of 10,000 million baht. This one for the number, the unit of money that we use baht per year, that we need to pay a lot of money for patients in this group. And the prevalence of most CKD patients is in the early stages. That is a big problem because when we see a patient, so in the early stage, the patient doesn't have a sign and symptom. So we don't know that if they don't check about the GFR, we don't know that they have kidney damage already because no sign and symptom. So the patient think that they okay, they don't have any problem with them. So they might be don't care about how to take care of themselves. So this one is a big problem because the early stage is no sign and symptom, and most patients not yet known that they have CKD that I told before. And if the diagnosis is in the early stage and began to change behavior, it will affect the slowing down of the deterioration of the kidney. This one is the main point that is very important, that if we know that early, so we can promote them or we can help the patient like to slow the progression of the kidney. because the CKD is it's cannot be back to be like the normal kidney, right? If they already damaged, so we can stay like stop to at that stage, but we can just reversible back into like the normal one. So that's why this one is we have to pay attention to this point. So I think like for the topic, next topic is very important. It's how to slow the progression of CKD. So nurses have to know like because some might meet the patient in OPD, some might meet in the like in the ward. So we all can meet the CKD patient like everywhere. So we can have or give them an education or how. So I will talk later that what is a nurse should do to help them to get like a better quality of life. So the first one that can slow the progression of CKD is the improved blood pressure control. Because controlling blood pressure is probably the most effective intervention to slow progressive kidney disease. And it's require a combination of antihypertensive medication and lifestyle modification. So the nurse have the role about the lifestyle modification that how we could help them to change the lifestyle. Because if someone have their habit like for a long time, it's difficult. Because in Thailand, maybe I don't know, like in your country, do you have the problem about like when you teach them that you have to do something like that, 1, 2, 3, 4, 5, but the patient still like don't do that. So this one still is a problem in Thailand because they think that it's okay, they have this habit, so it's not affect to their kidney, so they don't change their lifestyle. And next, we have to use how to lower the blood pressure. We need to use both for the nursing care and for the medication. And for the medication that recommended, it's angiotensin converting enzyme inhibitor and angiotensin receptor blocker that can control blood pressure and to reduce the albuminuria. Some might ask like if you say that control the blood pressure, so what is the number that we have to control it? For the C or KDI, they say that the targeted blood pressure of CKD patient with urine albumin level is less than 30 milligram per day, or protein to creatinine ratio is less than 150 milligram per gram. We have to control less than 140 and 90 millimeter broad. And patient with urine albumin level more than 30 milligram per day or PCR more than 150 milligram per gram is less than 130/80 millimeter broad. This one is also we have the Nephrology Society of Thailand. We use a guideline. Uh, this one as the same with US and another that use this guideline also. And then, except from the controlling the blood pressure, the blood glucose control, it's very important one too for patient with diabetes with a target that for the target hemoglobin A1C, we have to control it approximately 7%. The next one is nursing care in CKD because the three main nursing care goals are prevent or slow disease progression, the first one, and the second one is to promote physical and psychosocial well-being. And the last one is to monitor disease and treatment complication. So I will go with the first one. To prevent or slow disease progression, it's the collaborate with patient and provider to target modifiable risk factor, especially specifically focusing on diabetes and hypertension management to keep glucose level and blood pressure reading within appropriate target ranks. This one I already talked before. That is, what is the number that we have to keep in the rank that is the good one. And next is the self management techniques. So I will talk it later that it's very important for nurses that we have to help the patient to do self management because this CKD is a chronic one. So it's still with the patient until they die. So they have to know how to manage themselves like properly. So this one is very important one. And also the medication therapy guide management that we have to use like at the same time together. And to encourage patients to perceive the self-efficacy in self-care assessment, analyzing, planning, making decision in action, and taking action according to uh, the planning and assessing the result after practice. Because the patient, uh, if they perceive that they have self-efficacy, so they will have confidence to take care of themselves. But if they feel that they don't know or they lack of knowledge to take care of themselves, they cannot do that. So, so the nurses choose encourage people to perceive like they have self-efficacy to take care of themselves. And also the psychological support using empowerment so that patient having confidence that I talked before. So nurse again how to empower our patient and also the provider that stay, the caregiver that stay with the patient to have their empower to take care or empower to change the lifestyle. It has a when we gonna help them to have more confidence in self management. We can assess patient self management ability before and after educational session. So most of us use like a educational session to help them have the skill in self management. Or someone might set like a program that to help the patient to have ability to take care of themselves. First, you have to assess patient like what is self management ability by asking the question like how is your physical and or emotional health, or what are you worry or what concern you most, and what important for you to achieve, what are your priorities, what would improve your quality of life and well-being, how are you and your loved one handling your illness. This one is the question that you will assess that what is the self-efficacy that the patient have from the answer that they answer to us. Okay. So and this picture is it's a handbook that is we everyone can enter or use by go into world wide web nephrothai.org. So this one is a clinical guideline that to take care of patient with CKD. So if we have a problem, we can go like online or search for the how we could do how nurse or the nurse the healthcare personnel have to do to help the patient coping with this disease or to do like a lifestyle modification. So we use this one in Thailand. And for the self management that I talked before, this one is very important one to help the patient to have the confidence in themselves. The first one is we have to teach them or let them know that they have to maintaining a healthy weight is the key to CKD self-management. By achieve a healthy weight is the body mass index. It's 20 to 25, because the research show that for the one that is overweight or malnourished, patient is cause of chronic infection and result in anemia of CKD patient. So we have to try to help them to stay have a healthy weight around this one. And CKD patients should take physical activity, because some might think that, oh, because I'm a sick person, so it's not necessary for us to take a physical activity, but it's wrong, because the CKD patient should take physical activity like the normal person do, and aiming for at least 30 minutes or 5 times per week. So this one is very important one, because the evidence show that exercise help stimulate the bone marrow. So it helps to increase the amount of blood cell and hemoglobin level. And also the exercise help strengthen the muscle and increase the ability of physical function, and also stimulate the immune system and reduce the production of inflammatory substance. See, it's a lot of problem of physical activity or exercise. So we have to encourage patients to do that. And then this one is the big problem in Thailand. It's about dietary modification, because the patient they feel that they eat the same way that they like, because they don't change, and it's very difficult to change, because when we ask them why, they said because if they change about the taste of the food, maybe they cannot eat, they eat less. So they say they still stay in the same level of the seasoning that they use, because the recommendations say that the lowering protein intake to zero point 0.8 gram per kilo per day in adult with diabetes or without diabetes, and GFR less than 30 cc per minute. With appropriate education, this one we have to lowering the protein intake in this group of person. And we have to encourage patients to eat a variety of food that are fresh, lean, low fat, low sugar, and low cholesterol. And then this one is the big part of problem, the lowering salt intake to less than 90 millimole or less than 2 grams per day. And this one is the technique. If you want to help them to lower salt intake, maybe it's some tip that you can suggest them. The first one is maybe is your the patient testing how to test food before adding seasoning, and avoid fermented food, because in Thailand we have a lot of food that is fermented. For example, I don't know in your country you have a lot of fermented food or not, because you can share in this point. And because we have the fermented fish, the pickled crab, the salted fish, and the preserved fruit or salted egg. So this one is can cause more sodium or a lot of salt intake if we like to eat this food. And another tip is adding seasoning only half of them used to feel normally. So we have to educate patient try to lower the salt intake, and do not place the condiment on the dining table, because if you saw it, right? If you see it that, oh, it has the season, so you will grab it and to add it in your food. So do not place the condiment on the dining table. It's another tip. And and then read the food label before purchasing, especially the amount of nutrients or amount of sodium that is like a high or low, and should add other flavor instead. For example, spicy, sour instead of like salty. So this one just like a tip that if you want to uh, convince or help them to lower the salt intake. And then this one, the individual with CKD have to receive expert dietary advice and information in the context of an educational program tailored to severity of CKD and the need to intervene on salt, phosphate, potassium, and protein intake. Because I just talk about the salt and protein, but in some cases they have a high phosphatemia too. It's high phosphate and the high potassium. If like the state of the CKD is in the 3 state or 4 state, this one is you gonna the patient gonna have a problem about the electrolyte imbalance, about the phosphate and potassium also. So it's depend on the state of CKD that you meet. So if they have a problem, not just only salt or protein intake, so you have to consider about the phosphate and potassium as well. Next is the patient should avoid alcohol and nephrotoxin because this one can cause has a like a reabsorption of sodium and water like overload in the body. So it can cause a problem about hypertension later. And cigarette smoking, it's you we need to teach them like you have to stop smoking because it's associated with abnormal urine albumin and progression of CKD. And also smoking, it's also contribute to death from stroke and heart attack in people with CKD. And the statistics show that uh, 14 to 60 times of CKD patients likely to die from cardiovascular disease more than end-stage renal disease. So this is why we have to suggest them to have a smoking cessation. And we have to educate patients about how to protect themselves from injury and infection. Because when patient have infection, uh, the when infected, the cytokine is released into the bloodstream, which had an effect to inhibit iron absorption, resulting in the body having iron deficiency and cause anemia. And also the cytokine is suppress the production of erythropoietin hormone and shorten the lifespan of the hormone. So it causes anemia in patient with infection. So in CKD, patients should take care of themselves strictly to keeping the body clean, stay healthy, exercise, wear a surgical mask, and avoid to stay in crowded places. So we have to teach patients how to recognize signs and symptoms of infection and to report them to healthcare provider also. And provide the patient-specific education such as the overview of CKD treatment and cell management technique. So this is why I'm gonna share the list of attribute of effective cell management intervention and system support. The evidence said that. So some may use the technique about the follow-up call because you're gonna know that is what is their lifestyle. It's they change or not change by do a follow-up call, or you might use a strategy about the nurse case management. And also the patient empowerment is very important one too. So nurses can be coach or support the patient or provide a group empowerment session for them too to empowerment them. And the collaborative goal setting and problem solving is a important one also, because if the goal setting is come from nurses, because the patient don't realize that it's not their goal because it's the nurse goal. So you have to collaborate with the patient, like what is your goal setting and what is your skill to do a problem solving. If the patient doesn't have more skill, we have to teach them or help them to have a skill to take care of themselves. So to take care of the CKD patient, it's gonna work uh, if we use like the multidisciplinary team together, not just only nurses, but we need to have a team. And patient and the caregiver is one of the important team. So they have to know or they have to plan or talk to them together, before we want to do something with them. So we need to ask what is the opinion from the patient, from the caregiver, and we plan together. So it's a self management. It's going to be effective in this. And some may ask that the patient education session, we have to think about it also if we want to teach our patient. So we have to decide we have to teach them individually or we have to teach them in a group. So you have to decide. And you have to teach them how many times, one time or periodic or several times. And how long for the courses that you want to teach them. If the short-term courses is 4 to 6 sessions, or you want to be a long-term courses like 6 to 12 months. So this one you have to decide the program if you want to help them to have a self-management skill or you want to help them like to empower them or to persuade them like to take care of themselves. And the material also, the educational material is important one. You have to think about which material that you're going to use. It's the audio visual or electronic, the internet. Yeah. So this one, it have to fit with your patient. Okay. And the overview of CKD, this one, it should include information about normal kidney function, common causes and risk factor, diagnosing, testing, staging, symptom, and complication. This one have to add in your information that the patient have to know too, because if you want them to take care of themselves effectively, they have to know all of this and they have to plan it to have a goal so they can follow the plan and they can evaluate that the plan is work or not. If it doesn't work, how should they do that next? Okay. And to promote the physical and psychosocial well-being, it's important also because the patient with CKD are at risk for many psychosocial issues such as anxiety, depression, and stress because this disease is cause them a lot of problem, both physical and mental. Maybe it's not two of this, but maybe the social. They cannot go to have the socialization, or they have a problem about their economic. So this one cause them has a psychosocial problem. So we are have to assess the patient's psychosocial status and coping mechanism and help them identify strategies, resources, and intervention to support their well-being. And we have to help deliver treatment by assessing, planning, implementing, and evaluating care plan. This one is a nursing process that we use all the time to help the patient and to help them and start from the first uh, process until the evaluation. And we can change the plan if it doesn't work. So we have to think about like what factor that cause them, or it's a problem that is an obstacle that make them have a successful uh, to take care of themselves. For to monitor disease and treatment complication, we have to pay attention if your patient is experiencing fluid overload. You may need to carry out provider order that include applying fluid restriction and or administer diuretic medication too. And electrolyte imbalance may require dietary change and or medication administration. So we come to like the end of this talk. For the takeaway message is understand. So nurse have to understand how to prevent or slow disease progression. So it's a lifestyle modification, so management education that I talked before, and the skill that is important. Skill of providing patient education and monitoring the disease and its treatment. Because if we have a skill or providing patient education, so we're gonna know that which point is very important, because we cannot teach them like a whole bunch of knowledge, right? Because it's too much for them. So the nurse should know like which are topic it's important for them, and we help them, we guide them, you show them how to do that. Mm. And with that knowledge and confidence, if our nurses have a knowledge and confidence, so you can promote patient physical and psychosocial well-being to help ensure the quality of life of them. Okay, so that's all for my presentation for today, and thank you very much for your attention. Okay, thank you.
You're welcome, Dr. Sarinya. Kapun Kap Ajan. Please welcome Mrs. Sandra. Time is yours.
Thank you, Mr. Rasid. Assalamualaikum warahmatullahi wabarakatuh. Sawadika, Dr. Sarinya. Nice to meet you. Good afternoon for everyone. I would like to say thank you for your for coming to my presentation. It's great to see you all. Okay, ladies and gentlemen, let me introduce myself. My name is Sandra. I'm lecturer in medical surgical nursing, and thank you for moderator who helped me read my curriculum vitae. Okay, our topic today is fluid management in chronic kidney disease. Please let me presenting my slide today. Next, I will share my presentation slide. Wait a minute. Okay. Can you see my slide, moderator?
Yes, we can see it.
Okay. I want to slideshow now. Okay. Okay. Fluid management in chronic kidney disease with me, Sandra. And now we can introduce introduction related to what is delivered by Dr. Sarinya before about chronic kidney disease involves progressive irreversible loss of kidney function. Controlling fluid intake is one of the main problem for dialysis patient because under normal condition, human cannot last longer without fluid intake compared to food. Chronic kidney disease sufferers should control fluid intake to improve quality of life. most clients who are undergoing a hemodialysis therapy in Indonesia every 2 times per week and therapy for 4 to 5 hours. That means the body has to bear excess fluid between 2 dialysis time. The indicator to determine the amount of fluid intake and salt during interdialytic period and the patient compliance with fluid management called interdialytic weight gain, or we can call IDWG. Okay, next slide. Interdialytic weight gain can be an indicator of a patient fluid intake during an interdialytic period, can affect the health status of the patient during hemodialysis therapy. IDWG is an indicator of patient adherence to fluid regulation. In a patient with good compliance with fluid management, the IDWG does not exceed 2 kilograms or 3% of the dry weight. So IDWG measured based on the patient dry weight as well as from measurement patient clinical condition. So that's we call dry body weight is the body weight without excess fluid formed after hemodialysis, or the lowest safe weight is reached patient after dialysis. Okay, we can continue. IDWG was classified into 3 groups. Okay, like and then moderate, high. So we can like if weight gain less than 4%, and moderate if weight gain 4 to 6%, and high if weight gain more than 6%. The patient body weight was weighed routinely before and after hemodialysis. IDWG was calculated as pre-dialysis body weight minus the post-dialysis body weight of the previous hemodialysis session. Okay, this the patient body weight was weighed routinely before and after hemodialysis. For example, the body weight of the first post-hemodialysis patient is 54 kilogram. The weight of the second hemodialysis patient is 58 kilogram. The percentage of IDWG, quantity, 58 minus 54 divided by 58 multiplied by 100% is 6.8%. Like that, calculated. For example, okay, since body weight may influence nutritional and fluid intake, the results are also shown for IDWG as a percentage of dry body weight. Because dry body weight is clinically defined as the body weight as which the patient remains normotensive without antihypertensive medication. Okay, how high IDWG? The increase in IDWG can be caused by various factors like internal factor and then external factor. In internal factor include age, gender, education level, church, stress, self-efficacy, and external factor like namely family and social support and the amount of fluid intake. Let I explain you about age. Age increase IDWG value can be happen at any age. This thing deals with the compliance fluid intake regulation, but based on research result and several literature that the increasing age will be causing change in functional structure. And then we can look gender. Men are at risk CKD, compared to women. This matter because women have hormones more estrogen. You know, the hormone estrogen can affect calcium level in body by inhibiting formation certain cytokine to inhibit osteoclast. You know, osteoclast, calcium has a protective effect by preventing the absorption of the oxalate can form kidney stone, which is one of the causes of CKD. CKD. If he, sorry, this factor, if we not help our patient for poor management of fluid restriction, the calculation of high IDWG. Okay, next, fluid management. Fluid management skill in identifying problem, setting goal, problem solving, decision making in response to fluctuating sign and symptom, taking action in response to the physiological response to body fluid deficiency, monitoring and managing symptom. Fluid management greatly influence the calculation of IDWG. So how fluid restriction? Fluid restriction are focused on two dimensions, like reduce salt intake and control fluid intake. You know, CKD patient urinate no more than 200 to 300 milliliter daily. Hence, patients are advised liquid not more than 500 milliliter or the equivalent of 2 glass per day. Fluid restriction must be done to adjust fluid intake with renal tolerance in regulation. The recommended fluid intake depends on in amount of urine 24 hours, namely the amount of urine 24 hours previously added 500 to 800 cc per day. Okay, next slide. How about role of nurse? The role of nurse this case are to educate patient or family regarding fluid intake and output, salt consumption, fluid needs, helping to enhance self-efficacy in fluid managing, to improve patient compliance to treatment regimen. For tracking food, okay, and then providing specific individualized split goals, and then managing thirst and limiting excessive sodium intake and adjusting dialysis regimen to meet patient needs. Okay, tracking fluid intake and weight. We can write down the fluid intake in small notebook. Include liquid with meals, snacks, and medication. Use a water bottle that is marked with daily liquid goal in ounce or milliliter. Measure fluid amounts to ensure correct portion size. Talk to the doctor and dietitian about the specific weight and fluid restriction goal. And let's use a small glass to drink. Okay. Okay, let's see a picture, but fluid balance record. This is explained about monitoring can be done by using an intake and output chart that contains detail of the amount of fluid intake and urine output every hours. In urine intake and output within 24 hours are then calculated to determine the fluid balance, like client hydration status, and determine the amount of fluid that is safe for the client to drink for the next day. Calculate fluid of like monitoring water weight. This is using a fluid intake output chart, requiring the nurse knowledge of the patient condition And history, careful examination and observation of the nurse and understanding of the result of special examination regarding fluid balance. The chart used by nurse is the one that meet the standard, like this, consisting of name, and then medical record number, intake and output added up after 24 hours of monitoring using a measuring instrument for fluid intake and or urine output. Okay, let's see the right picture fluid balance record. They're monitoring water weight. It's explained that keep a daily log of your weight, use the washroom, and do not eat before weighing yourself. And then weigh yourself every day using the same scale and weigh yourself at the same time every morning. So this method requires patient or family cooperation. Okay. How to controlling thirst? Okay, controlling thirst. Avoid foods high in salt that cause increased thirst and blood pressure. How to be control sugar intake, as too much sugar and high blood sugar increase thirst. And then suck on frozen fruit such as blueberries and grapes, limit to half cup serving. And then chew gum or suck on hard candy, often gargle, but don't swallow the water, used to rinse. And then if the patient have a dry mouth, you can educate about use a spray bottle to moisten the mouth. And then sucking ice cube temporarily relieves thirst, but may increase the water intake if used very often. Okay, and next slide. To reducing salt in your diet, we can educate our patient about begin reading food labels as a matter of course, and then use fresh rather than packaged food, and then don't buy low sodium salt and use salt-free bread, to pinch of salt in a day, better on just cook foods. And you can substitute in the kitchen and the dinner table spice and herb for salt. Okay, limit salt intake. I explained that enough for my presentation. Thank you so much for all the lecturer and students who are very excited today, very excited. Yeah, thank you for all your question, and maybe for didn't answer at all. I'm sorry for my bad English and pronunciation, for all my mistake. Sorry, yeah, when I explain the topic in slide. Yeah, and thank you for all your attention. I'm Sandra. Goodbye, everyone. Sawadika. Okay. I'm return to Mr. Rashid, and please, moderator, and then I close my screen sharing now. Okay, stop sharing.
Okay, thank you, Mrs. Sandra, for presenting the important topic about fluid management. All right, now we are going to the discussion session. Thanks to our audience who have posed the good question. I apologize that can be accommodate all the question to be answered due to time limitation. Okay, first question is intended to Dr. Sarinya. Okay. Dr. Sarinya?
Yes.
The question is how to control infection during the patient get a CAPD, peritoneal dialysis in Thailand? Control the infection.
Okay, for the peritoneal dialysis in Thailand, we're gonna have a session to teach the patient for uh, 2 weeks, you know, before we try to do a peritoneal dialysis. We're gonna have patient with the caregiver, to come to the nurse session. That we're gonna teach them about uh, the information about the kidneys, Then we're gonna teach them about how to do that. This one is including CAPD, the continuous peritoneal dialysis also. Yes, and we just include the caregiver also why we teach them. So we're gonna ask the caregiver to take care of the patient or help them to see or to warn them which one this can get the infection. For example, when they wash their hand, something like that, So are the other step to do why they change the bag of dialysis. So every step, we try to show them. We have a video also, why we teach them, and also the environment is very important one. So we have to prepare the environment why they change why they change the fluid or why they exchange the peritoneal dialysis. So the environment or the knowledge of the patient and the caregiver. And so we have the hotline, the call. If the patient or the caregiver have a problem or when they're not sure what they're gonna do or they're not sure, so they can call us. They call nurse, call nurse to ask how should they do. They call hotline, and also we give them a brochure like the way to do the step by step. So this one, the whole thing that we do, so maybe can protect their infection, and we teach them how to observe the sign and symptom if they have the sign and symptom of the catheter, something like that, or the fluid that is changed. So they're gonna know which one that they can call or come to see the doctor. So that's all.
Okay, thank you for your answer, Dr. Sarinya. And then we are going to second question for you, Dr. Sarinya.
Okay.
How nurses give motivation for a CKD patient or family member to prefer to prevent disease progression in Thailand?
Again, please.
Okay. How nurses give motivation for a CKD or family member of patient to prevent a disease progression in Thailand?
Okay, so we have a lot of program, So because the patient has to go back into the community, right? Because they live in the community. So we have the network also. So the nurse in the hospital have a network with the nurse that work in community. So we're gonna share or refer the information to that community that what is the problem or what is the stage of the disease to the nurse in community. So the nurse community has a duty to come to visit the patient and the caregiver uh, in their home, and we can check up their body and teach them or show them or empower them how to do a lifestyle modification and let them ask the question. Yeah, so we have a network, and also we have a package or handbook package that yeah, we can give it to them. So it's if they have a problem or they're not sure about how they're gonna do, so maybe they can contact, because the nurse in community is stay close with them, because they have to take a responsibility. But if the nurse in the community doesn't know, they're gonna consult like the nurse in the hospital again. It's a network too. Yeah.
Okay, thank you, Dr. Sarinya, for the answer. Maybe the audience can take a critical point from what Dr. Sarinya said. And then we goes to question for our second speaker, Mrs. Sandra. You can hear me, Mrs. Sandra?
Okay.
Okay.
I can hear you.
Okay.
Okay.
Maybe it's out of context, I think. But and the question is, in the emergency case for CKD patient,
so can you repeat again?
what is the best side to puncture of patient bloodstream to do hemodialysis?
Okay.
Can you understand what I say? Maybe I would like to repeat again.
Okay, no. Thank you, Anissa.
Okay, in the case of urgent or emergency hemodialysis, where the atrioventricular taken place.
Okay. Maybe I can minta tolong itu apa bahasa help to Dr. Sarinya to lebih ensure to lebih lengkap itu expertise. Okay, I try to ensure is apa namanya expression about in an emergency situation, arterial access that can be done is to stay through the large and easily accessible arteries. So namely the radial and femoral arteries. So that's my answer.
Okay,
How
Mrs.
about
Sandra?
my answer?
Thank you for the answer. Maybe it out of context, I think. Okay. Okay, maybe that's all our event today.
Maybe moderator, maybe Dr. Sarinya
okay. Thank you.
Thank you. Okay.
Okay, thank you for reminding me. Okay, Dr. Sarinya, when the emergency case and the patient should take hemodialysis, so where is the site for arteriovenola taken place?
So it depends, it's not just like the nurse take that decision, because it has to be a physician too,
Yes.
to decide which that they're gonna do that, So we have from theory, we have many places that we can do to like the AV fistula, right? The femoral, some kind like that. If the patient have the ulcer or cannot do at that place, we're gonna change it to another place. So it depends, not just exactly like which side that is very good or very best. But the famous one is the AV fistula. Yeah.
Okay, thank you, Dr.
Thank
Sarinya,
you,
for the
Dr.
answer.
Sarinya.
Okay, all right. Maybe now we are. Okay, thank you for your response and answer to audience question. All questions were good question, and I hope that audience can accept and understand the answer to each question. And then conclusion of our discussion today, nurses are expected to increase their competence in fulfilling the patient needs, CKD patient needs, and increase patient and family participation in care to improve patient's quality of life. For my dearest audience, please fill your attendance and feedback toward this event on the link that has shared before in the Zoom Messenger. Your feedback is very helpful for improvement in the next similar event. All right, that's all our discussion session today. I would like to say thanks to our great speaker for sharing knowledge, and I salute to the audience who have remained faithful in the topic presentation until discussion session. I hope this pandemic will end soon and we can return to our normal activities. Thanks to BCN Surin for participating as guest lecturers today at STIKes Tuah Pekanbaru, Indonesia. I hope we can hold a similar event in the next year. Hopefully, we can always strengthen our friendship and partnership for the future. I also would like to thanks to all committee for your cooperation. Maybe thank you for your attention. Assalamualaikum, sawadika, good afternoon.
Sawadika.
Sarinya. So now, thank you for Mr. Denny. Maybe, okay, well, let's listen to the presentation for Dr. Sarinya Paul Sinchan with the title, The Role of Nurses in Caring for Patients with Chronic Kidney Disease. Please welcome Dr. Sarinya. Time is yours.